Eisenhower Health has always been willing to invest in current, cutting-edge technologies such as surgical robots. And as a result, Eisenhower was the first hospital in California to acquire the Mako partial knee replacement system several years ago. During my fellowship at the Hospital for Special Surgery in New York, I was able to experience the early years of robotic hip and knee replacement surgery. Several years later, our robotic experience at Eisenhower Desert Orthopedic Center has grown to where we are now the busiest robotic center in the world for joint replacement surgery. We are currently doing hip and knee replacement surgery, but in the near future, we look to add robotic shoulder surgery, robotic knee replacement revision surgery, and robotic hip replacement revision surgery. Through our extensive experience, which centers around patient outcomes, complication avoidance, and surgical efficiency, we have learned a lot about what works and what doesn't work in the operating room. Robotic joint replacement surgery has really allowed us to be objective with our outcomes by giving us specific patient variables in real time in the operating room, and to be able to process those variables and make on-the-fly adjustments as needed to avoid common pitfalls in joint replacement surgery. Focusing on post-operative outcomes, we believe that robotic joint replacement surgery gives us so much more data than we otherwise wouldn't have when making surgical decisions. Not only does this allow us to be exacting with our surgery, it allows for soft tissue and bone conservation, precise planning of implant fit, and more efficient surgery for the patient. Our joint replacement surgeons here at Desert Orthopedic Center lead a monthly multidisciplinary meeting where we get input from patients, nurses, therapists, and surgery coordinators to discuss the aspects of the patient-centered experience, and are always striving to improve not just the surgical outcomes, but the overall patient experience when you are going through a joint replacement surgery. We are very proud of what we have built over the years, and we are always looking for ways to improve our program, providing you the very best in orthopedic care.